Okay, I think I should get started.
Mhm.
Mm-hmm.
So this is Tom Gong. I'm from Wuhan United, and we're very happy to organize this online seminar. So we have invited Dr. Lei Zhao from Wuhan. He's a professor of medicine, Department of Infectious Disease at the Wuhan Union Hospital, Tongji Medical College, Huazhong University of Science and Technology. Is the largest hospital in Wuhan. And Dr. Zhao has also did postdoctoral training at the Massachusetts General Hospital, Harvard Medical School. And he has fought on the front line of fighting coronavirus in the past 3 months. And he has personally treated 96 patients and also helped other doctors to treat a lot of other patients as well. So Dr. Julia Zhu from Stanford Healthcare will interview Dr. Zhao. So let me let Dr. Zhu take over.
Hi, everybody. Welcome. I'm Julia Su. I'm a family doctor in San Francisco Bay Area. As COVID-19 is spreading all over the world, everybody is affected one way or the other. We are all in it. We'll be in it for a long while, for quite a while. Our county has been under lockdown more than a week now. A lot of us are isolated at home, watch the news, and see the number going up every day. Some may have heard family or friends falling sick. It is a time filled with anxiety, fear, and confusion. We'd like to take this chance sharing current knowledge and the information to empower ourselves and to help make the right decision, protect ourselves, our family, and our communities. This talk is primarily targeted to a general audience. For physicians wanting more information, we have a resource provided at the end. Thank you for those. Thank you to those who submit questions. We will incorporate questions into the talk, make it interactive and engaging. So I'll give to Dr. Xiao.
Okay. Good afternoon, everyone. My friends and my families living overseas. We have passed a disaster in the January and February in Wuhan, and let me introduce some experience for the COVID-19. So let's begin in the PPT. So show you what we did and what we have done in the past in Wuhan. First, we will introduce the Wuhan city for you. Wuhan city lies in the central China. There are 12 million people living here and 1 million students in the city, divided by the Yangtze River and Han River. The city divided into 3 towns, Wuchang, Hankou, and Haiyang towns. 25 covered by the city. 25 of the city covered by the water, and 200 miles long subway. She is a major technology center of China. The city is a major transportation hub, and there will be 5 hours by the high speed train could reach the main cities such as Beijing, Shanghai, and Guangzhou. And she has direct flight to San Francisco, New York, and the other main cities all over the world. The pictures show the big sightseeing in Wuhan. According to the Xinhua News, on March 26th, no new confirmed cases of the COVID-19 were reported Wednesday in Wuhan. And no new suspected cases were also reported in Hubei in March 25th. Hubei has so far reported a total of 67,801 COVID-19 confirmed cases. And in Wuhan, there are 50,006 cases of the COVID-19.
It is encouraging to see Wuhan, the very first epicenter, contain the outbreak within 2 months. They are going to lift lockdown slowly in early April. Let's go back to January in Wuhan. As more and more patients presented with an unusual pneumonia, on January 23rd, lockdown was imposed on Wuhan. People were told to stay home. All the public transportation halted. No one was allowed to leave the city. This graph, how to do the mark? So okay. So this graph showed the number of new cases over time. Number of new cases over time. This is a number of accumulated cases over time. So this is 23rd. This is the day when the city is locked down. So as we can see, during the first, second, and the third week, the new cases continue to rise. We see the peak here. The reason for this peak is due to, one, there's increased capacity of the testing. Second is they also changed the criteria for the diagnosis. Here, they only count confirmed case, meaning that the patient had a positive nucleic acid test. And then when we see the peak here, they include, in addition to the confirmed cases, the so-called clinical cases was also included. By clinical cases, meaning that the patient had clinical symptoms, lab report, and chest imaging consistent with COVID-19 infection. They don't necessarily have this positive nucleic acid test. When this peak, I think it's on the 13th February, the new cases on that day was 13,436. At the time, the total cases was 13. The new cases 13,400, and then the total cases was 32,994. So after that, we can see the decline of new cases, like say, continue to decline. By the, I think the March 18th was the first day 0 new cases was reported. And then the same thing show here, the accumulated cases flattened out after that. So I will ask Dr. Zhao to talk about what measures the health system, the city, and the country have taken for this to happen.
Yeah, about the Wuhan in the COVID-19, the city built 2 hospitals, the Hosenshan hospitals and hospital and Lei Zhao hospital. The 2 hospitals were built up within 2 weeks. More than 2,000 patients were admitted and received proper care. Start the February 3rd. That's the pictures of the hospital building area. And moreover, the stadiums, convention center, and warehouses were transformed into the makeshift hospitals and put into service overnight. Housing patients with mild symptoms or no symptoms. And the function is isolation and monitoring the patient. And the picture is the upper picture is the makeshift hospitals, and the city start a more strict lockdown. The lower pictures show the volunteer deliver the food to the resident.
Right. So it's a really strict lockdown. The residents were not allowed to even leave their home. And then all the shops, the groceries were closed. So the food or life essentials were delivered to the resident by the volunteer. I have a question here saying that the makeshift hospital there are also patients without symptoms in the makeshift hospital. So it seems like the city also testing patient without symptoms. Are the city testing everyone there?
It's just for testing the person with symptoms and the person closely contact.
I see. So the patient with exposure were tested, even when they don't have symptoms. I see. And also, what kind of a treatment, like say, offered in the makeshift hospital? Is the was the oxygen therapy available there?
Yeah, the therapy in the makeshift hospital include antiviral treatment, the symptom relieve the symptom treatment, and herbal medicine, the traditional Chinese medicine.
Traditional Chinese herbal medicine. So there's no oxygen therapy there.
Just combine the therapy.
Combined therapy. So they are all very mild, the patient with mild symptoms. I think I watched those video clip. They would check, like say, temperature every day, a few times every day. And then they also exercise a few times a day. They were dancing and then practice Tai Chi.
Yeah. And there are physicians and nurses in the makeshift hospitals, and every day they monitor the all the patients and give them the medications, and so if a patient become severe, they will send them to the normal hospital.
I see. Yeah. It seems like this makeshift hospital, establish of the makeshift hospital was the turning point for the outbreak of containment. Before this, there are a lot of cases involve within family or within house transmission. Like say, the disease was transmitted from mom to child to a kid. Disease transmitted from parents to grandparents. There a horrible story like say a child lost both parents. There's even one story involved the son or the grandparents passed away one after the other from the disease. As the son also get the disease while taking care of both parents, he died on the same day. His sister, who was a nurse, also died, and his wife was, say, in the ICU. And then for the makeshift hospital, it basically admitted every patient with positive test. So basically, the policy at the time is admitted every patient, isolate them.
So the makeshift hospital changed the situation of the disease in the city. And 42,000 professional medical personnel from all over the country were sent to back up Wuhan city, including 28,600 nurses, accounting for the 68% of the medical team.
Yeah, it is amazing to see that more than half of the workforce, healthcare workforce, is coming from outside of the city. There was pouring support all over the country coming to Wuhan. They send their PPE, medical equipment, along with their best doctors to Wuhan. They send their nurses, they send their specialists like a lung specialist, infectious disease doctor, and intensive care doctor. Next, we'll talk about the prevention and treatment. First, I'll let Dr. Zhao briefly review microbiology and epidemiology.
Okay, so let me know what is the COVID-19. The coronavirus is a large family that may cause illness in animals and humans. So it is a normal virus in the world. In humans, several.
Oh, I'm sorry.
Okay. So several coronavirus are known to cause respiratory infections, including the common cold, to more severe diseases. It's well known that the Middle East respiratory syndrome and severe acute respiratory syndrome is the well-known disease in the past 20 years. And last year, the COVID-19 is a newly confirmed coronavirus, and it will cause the severe symptoms, and now is a pandemic all over the world. So let me learn how does the COVID-19 spread? It's very important for personal prevention. The virus can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surface around the person. Other people then catch the virus by touching this object or surface, then touch their eyes, nose, and the mouth, he or she will be infected. People can also catch the virus if they breathe in droplets from a person with COVID-19 who cough out or exhales droplets. So the patient infected by the novel coronavirus are the main source of the main source of the infection. Asymptomatic infected people can also be an infectious source, and transmission of the virus happens mainly through respiratory droplet and close contact. There is a possible of aerosol transmission in a relative closed environment for a long time exposure to high concentration of the aerosol. Attention should be paid to feces or urine contaminated environmental that lead to aerosol or contact transmission. So
okay. Yeah, so I'll talk about this one. This is the this I copied from the CDC guideline, how to prevent from COVID-19 infection. I'm pretty sure everyone is familiar with this information, but devils lies in the details. So I do have a few points I want to mention. For the hand wash, we need to wash them thoroughly and long enough and wash often. I would like to do a demo on how to wash hands. Let me just show. Is it? Can you? Yeah. So say we get the soap and get soap and the water. So we wash the palm. We wash between the finger. We wash the back of the hand between the finger, back of the hand between the finger, and then we also wash the nails. Wash the nails, and underneath the nail. So don't forget your thumb, okay? And then we rinse our hands, and then we get the paper towel, dry the hand, and then we use the paper towel to turn off the faucet so we don't get, say, touch the faucet again. Let me go back. How to go back? I'll share the screen. Okay. Share the screen again. Okay. So we should be, like, say, always be, like, say, aware, like, okay, keep our hands clean all the time. And then we may want to carry a sanitizer when go out. If we touch doorknob, we want to rub on sanitizer afterwards, or we touch the button in the elevator, we want sanitize, rubbing on sanitize, sanitize afterwards. When we apply the sanitizer, we want to cover all the hands and rub it until dry. For social distance, I mean, that's easy to understand. I put a distance, they say 6 feet distance between others. Don't shake your hands. Don't high five. Okay. If you're sick, please stay home. Please wear a mask. And then we got a lot of questions on the mask. So Dr. Zhao will talk about just in a bit. Regarding this clean and disinfect the service, if the service is dirty, we want to clean with detergent or soap to remove the dirt or the grease. And then we apply, we can spray on the disinfectant, like say Lysol or even alcohol, which is appropriate for that particular surface. We won't let this disinfectant stay there for 2 to 3 minutes before you wipe the dry. And then next we'll have a few questions for Dr. Zhao on this topic. Oh, why is not, it doesn't go down. It doesn't go down. It's going.
Yeah, you can use this mouse.
Okay. Yeah, Dr. Zhao.
Yeah.
Yes. Yeah. So this is these are the questions for you.
Okay. Okay. So the first question is
about the mask.
Yeah, about the mask is in China. Experience the mask is the key way, to prevent prevent the COVID-19. In some report, the COVID-19 will spread by the droplet or the aerosol from the person when he or she cough or even speak, and so is in the Wuhan city, the government let everyone to wear a face mask. So I think the mask is the most important. The most important thing for the prevention. And the second question is, shall I disinfect the grocery delivered package? In my experience, when a person get into the grocery, they need to be careful for the hands. When he pick up the food and everyone into the baggage, and then take back to home, he will wash the hands and put the food and living essentials to clean the service and then discard the bag right away, and then wash the hands again. And the delivered package is also when a person put the materials in the envelope and onto clean the service, and then discard the envelope to the trash bin, and then wash the hands immediately, and then can touch the everything in home. And the second question is how to self-quarantine. In China, a person, if closely contacted the patient, or if he will be isolated in one room, in a single room, and he will let her friends or relatives to give the food or living essentials to him or her, and the friends or the relatives will stop at the gate of the room, and he or he need a single isolated bathroom, and use the by only herself or himself. And the fourth question is, can I get the disease from the cash mail? If a person carefully wash the hands, the chance to get the disease from the cash or mail is very little. So I think the wash hands is also important. And when he but I suggest the everyone to use the electronic money, electronic money, and use the email is a priority. And the fifth question is the central air conditioner safe? In Wuhan, the epidemic of the COVID-19 season is winter. We stopped every central air conditioner in the building. The central air conditioner will spread the virus. So we can only use a single air conditioner in the room. So the central air conditioner is not safe.
Mm.
And let me introduce the clinical manifestations. By now, the knowledge show that the incubation period is 1 to 14 days, mostly 3 or 7 days. Just within 1 week, the symptom will be on, and main manifestation include fever, fatigue, and dry cough. Nasal congestion, runny nose, sore throat, myalgia, and diarrhea are found in a few cases. Severe cases mostly develop dyspnea or hypoxemia after 1 week. It is worth noting that for severe or critically ill patient, the fever could be moderate or even bare noticeable. So the fever is not relative with the severe of the disease.
Dr. Zhao, and here mentioned severe cases mostly develop after 1 week. Is that a common presentation? Like say patient was doing all right for 1 week and all of a sudden they crushed?
Normally, yeah.
Wow.
So the patients will with mild symptoms did not develop pneumonia, but only low fever or mild fatigue. That's the mild patient. And from current stations, most patients have good prognosis, and a small number of patients are critically ill. It's less than 5%. And more than 80% is mild patient. The prognosis for the elderly and patients with chronic underlying disease is poor. The clinical course of a pregnant woman with the COVID-19 is similar to that of patients of the same age. And symptoms in children are relatively mild. So in Wuhan, there are no children died in hospital.
So here say children usually have mild symptoms?
Yes.
Okay.
Yeah.
But they could give the disease to parents or grandparents.
Yeah, they maybe spread.
Mm-hmm. Yeah. So, like say, for those patients you've been treated, if they went on ventilator, how long did say average patient stay on the ventilator, and then what percentage of them could survive?
Mm-hmm.
Dr. Zhao?
Okay.
Yeah, that's a question. Yeah, I didn't put on the slide, but it's a question I was asking. Like say, for those patients you treated, what percentage? I guess how long if the patient went on the ventilator, how long did they stay on it, and then what percentage of them could survive?
Mostly just for more than 80%. The patient is mild, and yeah, in my experience, the less than 5% of the patient is the severe, and the duration in the hospital, in inpatient hospital, is about the moderate patient need to half hour to stay at the hospital, and the severe patients need more than 1 week, more than one month.
More than 1 month.
Or more than 1 month for the treatment in the hospital.
Like say, what if the patient's on ventilator, what's the chance they can come off?
Ventilator.
Yeah, on ventilator.
Yeah. Yeah. It's a critical situation. When he is no invasive ventilator, it may be it's more than 1 month, and but it's invasive ventilator. The patient need to be sent to the ICU unit. It's longer than the normal severe patient. It's more than the longest one is more than 2 months.
Okay.
And the overall mortality rate is 3 to 4%. And elderly or patients with underlying disease are highly risk. Virus load is the highest during the first week of the infection, and it takes 1 week for symptoms to develop from mild to severe. So the 7 days is a window for the patient. That's the global pandemic situation in the map. And in China and in Europe and in the United States, there are many people infected by the COVID-19, especially in the United States and in the Europe countries such as Italy, France, United Kingdom. More and more cases were reported in recent days. And it's more than 100,000 reported cases all over the world.
Dr. Zhao, I'd like to ask a question about this fatality rate. It seems it varies a lot. So you mentioned in China, the fatality rate is about 2 to 3%. And then in Italy is much higher. It's probably above 8%. And then in South Korea is lower. What is the explanation there?
In Wuhan, I think the makeshift hospital isolate all the patients from the normal persons, and the closely contact is also be isolated into the hotel. So I think the China stopped the spreading by the cut down the spreading way. And I suggest that the people in the Europe and in the United States is more is carefully be isolated in the house or in the room. And I think the hospital accommodated the severe or critical patient is so fatality, the fatal rate can be controlled.
So we'll talk about treatment.
Okay, so let me learn about the treatment. Firstly, the suspect case should be treated in isolation in a single room, and the confirmed cases can be treated in the same room, and critical cases should be admitted to ICU as soon as possible. Strengthen the support therapy is very important, and the patient need to closely monitor vital signs and oxygen saturation. The laboratory tests, including the blood routine result, urine routine result, the C-reactive protein, and biochemical indicators such as liver enzyme, myocardial enzyme, and renal function, etc. And coagulation function and arterial blood gas analysis, and chest imaging and cytokine detection. Providing the effective oxygen therapy is the first way to the patient, especially to the severe or critical patient. And I think everyone is interested in the antiviral therapy. In China, there are several therapies for the COVID-19 in the clinical practice. The first is the alpha interferon. The interferon is effective for the virus infection. The interferon is used by the inhalation way. The second antiviral therapy is lopinavir and ritonavir, is the drugs to treat HIV in the past, and then we use the drugs to treat the COVID-19. And ribavirin is also effective therapy to the COVID-19. And in the seventh guideline of China treating COVID-19, they suggested chloroquine phosphate as an antiviral therapy. And some professors also recommend the hydroxychloroquine is also effective, but the effective is based on the experience. And in China, the antiviral drugs include Abidol. Abidol, I think is not be approved by the FDA, but approved by the China FDA. And further evaluation, the efficacy of the drugs currently being used. So the above, the medications is based on the the experience and the evidence will be made in the future. And if you want to use the drugs, you need to very careful for the adverse reactions, contra indications, and interactions of the drugs. We do not recommend the 3 or more antiviral drugs when they used in the same time.
Dr. Zhao, so among all the antiviral medication you listed, which one have you used the most?
We use the most the drugs is Abidol and interferon, because interferon is inhalation. So inhalation, the interferon is not for injection. It showed very low side effect, and Abidol is the first approved by the China FDA for antiviral therapies in the respiratory infection. So we use frequently.
Okay, we've heard a lot about this remdesivir and this combination treatment with hydroxychloroquine and azithromycin. Have you had any experience of those medication?
It's the Red River is in the clinical trials. So I don't know what is the result, and the result will be open in the later of the April.
Later of
and
April.
Yeah, the later of the April. And the hydroxychloroquine, I heard there are clinical trials in the United States.
Mm-hmm.
In China, the hydroxychloroquine is also be used in the treatment for the COVID-19, and sometimes it shows a good effect, but it only personal experience.
Okay.
And normally the antiviral therapy can be used in the early stage of the disease. In the late stage, the organ damage, if organ damage occurred, the antiviral therapy is not good, in fact.
Okay.
And the treatment of the severe and critical cases, the work may be done in the ICU unit. So I just introduced the treatment principles. So include the symptomatic treatment and prevent complications, and treatment underlying disease, and prevent secondary infections, and provide organ function support. And if the critical cases, they need respiratory support and oxygen therapy, and high flow nasal catheter oxygenation, and if the situation is more severe, they need low invasive mechanical ventilation. And then at the critical cases, for the critical cases, the invasive mechanical ventilation is needed. For the last stage, we also use rescue therapy, such as the ECMO.
Mm-hmm.
The ECMO is I think the rescue therapy. And for the severe or critical cases, we also need to have circulatory support and renal failure and renal replacement therapy, and some new treatment are also used in the clinical in China. For example, the convalescent plasma treatment and blood purification treatment and immunotherapy and glucocorticoid is also the very important therapy for the severe cases. But the glucocorticoid is be used in a short period of time, normally 3 to 5 days, for progressive deterioration of oxygenation indicators, rapid progress in imaging, and excessive activation of the body's inflammatory response. And we also impressed by the traditional Chinese medicine uses. The herbal medicine is very effective in the patient, especially in mild or moderate cases. That's the principles for the use of the traditional Chinese medicine. For example, the mild cases formula, moderate cases formula, severe cases formula, and critical cases formula. And the non-cleaning cleaning and detoxifying decoction is the first line recommend formula by the China FDA, China guideline, and we also use the formula for the convalescent period, and the patient symptoms was rapidly cured by the traditional Chinese medicine.
Wow. So this the herbal formula we used for so like every stage can be used at every stage, and also be used with antiviral medication.
It's a combined therapy, so we don't know what's the effect by the traditional Chinese medicine or by the antiviral treatment, but the effective is significant. Effectiveness is significant in my patient.
Your patient.
So in my patient, almost most of the patients are discharged in the end. The discharge criteria in the guideline include the body temperature is back to normal or more than 3 days. and respiratory symptom improved obviously, and pulmonary imaging shows obvious absorption of inflammation. Nucleic acid test negative twice consecutively on respiratory tract samples, such as sputum and nasal pharyngeal swab. The sampling interval being at least 24 hours. And discharged patient will be quarantined for 2 weeks at a central location before going home. And mostly is the hotel and the food and the fee in the hotel is covered by the government.
Oh, so the lodging and food are covered by the government.
Yeah.
Wow. And how about the cost for the, say, hospital medication? Do they have to pay? Do the patient have to pay?
All the fee is covered by the government.
Wow.
Including the food.
Including the food. Mm.
Yeah.
Okay, so we wrapped up with our talk. At the end, I also provide this resource, basically different website. The CDC website provide a lot of information on this disease, about prevention. Also, you can find information on international travel. John Hopkins, this site, if you sign up, they can send you email every day, give you update on this national or international patient numbers, global events, even emerging therapy. They also have information on the, let's say, upcoming paper from medical journal. And then you also want to get on the, there's also local county health department website. You'll get local information about school, business, or testing information. The last but not least, this is a platform created by Alibaba. It's more geared towards healthcare personnel. You can download a handbook on COVID-19 management. It's like a handbook you can download. I think it is also, you can also download an ebook from Amazon, same handbook. The handbook comes in different languages. The other thing you can do on this platform is you can get a free peer-to-peer consultation. Okay, so yeah, so that's the end of the talk. Tom, is any?
Tom. This is
Yeah.
Tom. So thanks for two doctors, and just want to add one more about the. Can you go to the first page, the disclaimer? Okay, this is simulates purely for educational purpose, and for medical advice, you should go to your doctors. Okay, just want to make sure. We have a lot of people from different countries and different cities. So when I ask you to ask a question, so introduce a little bit about what's happening in your city and then ask you a question, okay? Is David Curlander there?
Yes, can you hear me?
Yeah, David from Seattle. Can you describe what's happening in Seattle, then ask your question?
Right, well, Seattle was one of the first cities in the United States that was hit pretty hard by the COVID virus. But fortunately, the exponential growth seems to be decreasing right now. So we're very hopeful. But everybody is asked to stay at home right now. But a question that I had was whether in China they're testing for antibodies to the COVID-19 virus, and whether the doctors there have a sense as to what percentage of the population actually contracted the disease, and perhaps what percentage of the population was asymptomatic.
We do the test the antibody for the patient and for the close contact the person. So if the IgM positive, we think he is
It's acute infection.
Acute infection. And if the IgG are positive, he will in the covenant phase of the disease. And we don't have the data for what number of the infected in the city, because we only the infected person declined to the 0 for only I think for 3 or 4 days. So we I think our city will provide the data in the future.
David, from what I know is, say for those work in the hospital, say healthcare providers, doctors, physician, nurse, now they starting like say going back to work. They starting going back to work, and then before they are allowed to go back, they need to do tests to be clear. So they would do nucleic acid test, serology test, basically check the antibody, and the CT. So everyone has to go through this, at least the 3 tests before they get clearance to go back to work. So I think, and that's just a small cohort of data. It might be helpful. Yeah.
Mm-hmm.
Okay. Thank you.
David, did that answer your question?
Yeah, that answered my question. Thank you.
Okay, Dr. Safadi, are you there? Marco Safadi?
Yes, I'm here.
Okay,
It's
Dr.
Marco
Safadi from Brazil. Can you describe where you are, what's your situation and in your city, and ask your question?
Yeah, I'm based in São Paulo, which is a large city, almost 20 million inhabitants, and we are experiencing an increase in the number of cases. The issue is that we do not have enough tests to be done, so we are only testing at this point patients that are hospitalized. So the current rates are around 4,000 cases in Brazil and approximately 100 deaths. But we are clearly seeing an increasing trend in the number of cases and in death. My question was very related to the question pointed out by David. What I'm really interested in is the role of children. So would be very, very important to have some seroprevalence data from Wuhan showing the proportion of children and other age groups that were definitely infected. Taking in account the lack of severity in children, it does not mean that they are not infected.
Right.
So it would be very, very important to have this data, really to have the real role of children in the dynamics of transmission, etc. So I was really looking for this data to be shared with us, seroprevalence data.
Right.
Dr. Zhao, about children.
I'm not a doctor for children, so I only see the children is most of the children patient is mild, but I don't have the data, and I think there is for the Wuhan city is need time to give the data. I think is maybe a need a time to for the statistic.
Dr. Zhao, I remember you mentioned there's no young children in Wuhan died of this COVID-19. Is that true?
Yeah. That's no young children died in Wuhan. Just that's good news. That's good news. But I don't know the exact the rate of the children. What about the mild? What about the moderate and how many children severe? I don't know. I don't know what about the exact data.
Did that answer your question?
We don't have.
Yeah, not completely, but partially, I guess, right, Dr. Savati? Okay, we have, is Michael from Chicago there? Speak up, Michael, speak up. Hello, Michael from Chicago. Hello, Michael.
Hello.
Michael from Chicago?
Yep. Hi there.
Can you tell us what's happening in Chicago and ask your question?
Okay, so yeah, Chicago is, the cases have been increasing. I think we're about, today we're at 3,000, well, total Illinois, we're at 3,491, I think. About just over 2,000 of them are in Chicago itself. I just had a question regarding the therapies we were talking about earlier, specifically the antivirals. Was there any inclusion or exclusion criteria that you guys gave for who received versus who didn't receive these therapies? And did you kind of track their progression, and if there was data on that regarding those that received it versus those who didn't receive it? And I also saw that hydroxychloroquine with zinc was a possible therapy that would be possibly useful, given the fact that one of the mechanisms of hydroxychloroquine is that it's a zinc ionophore, and zinc is known to kind of prevent the replication of the virus. So I don't know if you have any thoughts on that.
Dr. Zhao.
Sorry, what is the question?
So how did you guys choose who received the antiviral therapies and who didn't?
Antiviral therapy?
Yes. Was it everyone that got it? Was it only...
how to choose?
Yeah, how did you guys...
谁接受这个治疗？哪些人接受？哪些人不接受？然后这些药之间有没有互斥，还是说可以一起用？
我想他是问，就是说，是不是有人不给他们不给他们这个抗病毒的药？还是说大家都接受抗病毒的药？是什么样的标准开始给他们抗病毒的药
？Okay. So in China, antiviral treatment is normally for the every patient, especially including the mild and asymptomatic patient in a makeshift hospital. The guideline recommend the 6 or more antiviral therapies, and if the patient can accept with no side effect, the will be treated by normally one antiviral treatment, but sometimes we use the two-way to antiviral because the interferon is for inhalation. So if a patient need or the condition is okay, so we can suggest the patient accept the one oral treatment and the one inhaling treatment.
Okay, so basically everyone, even from mild to very severe, received at least one form of antiviral treatment. And then you kind of progressively increase that depending on its effect on the patient, is what I'm getting.
Yeah, and for the patient in mild and moderate condition, the antiviral treatment is very important for to decrease the viral the virus neither.
Okay, thank you.
Michelle from New York City, are you there? Michelle from New York City, are you there?
Yes, I am. Hi, everyone.
Yeah, can you describe what's happening in New York and then ask your question?
Sure. So New York is pretty scary. As of right now, I believe there's 52,354 cases. As of today, there has been 728 deaths. Yeah, I mean, I'm going outside just to walk my dog for like 5 minutes once a day, and then I go back inside. But I feel like not everyone is taking it as seriously, which is kind of frustrating. But yeah, so my question is, looking into more integrative therapies like vitamin C. I know that there was a study on 15 grams of vitamin C. And then also I wanted to know if ozone IVs have been used, or your thoughts on hyperthermia treatment, getting people to above like around 42 degrees Celsius or around like 105, 107 degrees. Looking into those 3 types of treatments.
他是讲就是维生素 C 的，就国内有这样的治疗吗？维生素 C，还有一个加热的治疗，高温的治疗。
Yeah, I just see the suggestion in the internet before, and in China the vitamins is also suggested for prevention, but it's only for the stress and the health. It's not for to prevent the virus. It's only for health, and the heating. If for example have a heat bath, is also recommended for relieve the fatigue. But it's only it's also only the way for the health, for the body to the stress and the immune system, but it's not for prevention the infection. It's the commonly preventive way.
Thank you, that makes sense. And sorry, and have you seen anything with ozone infusions?
Ozone?
Yeah, ozone IVs. I know a few doctors in New York are doing it, and they are seeing some results, so I didn't know if that was practiced at all with you guys.
Ozone? What is ozone?
I don't know.
It's another functional medicine therapy, and I thought because there was an issue with breathing and inhalation that ozone could possibly help with that process. Yeah, so that's why I'm asking him. I have actually an interview with 3 other doctors in New York this week that are doing it, so I'm hoping to find out a little bit more information, and then I'm going to present an article with it.
Yeah.
Have you seen anything with like IVIG, so immunoglobulin therapy?
IVIG,
or
okay.
Yeah, they do that.
Okay. So at the first stage, we use the IVIG for the severe or the critical patient. We don't use we didn't use it to the mild and the moderate patient. But in the guideline for the COVID-19 in China, we don't find IVIG in the guideline. But if the situation is rapidly progress, we use the IVIG, and sometimes we use the glucocorticoid together.
And what have the results been? Have they been promising, or is it kind of hard to tell?
Some are cured and some are not effective.
Okay, thank you. Thanks so much for your time.
Okay, Dr. Yulian from Indonesia, are you there?
Hi, yes, I'm here.
Can you tell me what's happening in Indonesia and ask you a question?
Yeah, we have a lot of, I think, asymptomatic carrier in Indonesia, and it's difficult for us to make a lockdown in our country. So we have a very limited stock of personal protective equipment. How we should manage about this? Can we make a reuse? Can we reuse the protective equipment? How to deal with it? And is it effective to use just only hydrochloroquine, or we must combine hydrochloroquine with another antiviral, which in here we only have oseltamivir. We don't have a lot of like ritonavir, lopinavir, ribavirin. It's a very few in here. I think that's for temporary question. Hello.
For the hydroxychloroquine is used in Chinese doctors, and we observed some patients are in some patients the hydroxychloroquine is effective, and sometimes it lead to combined with the antibiotics, and sometimes the effect is not good. I don't know what about the indicators, but I think I have seen the clinical trials in the United States is going on. So I'm also wondering about the result of the clinical trials, and it is important that the antibiotics is also a way to control the pneumonia, because some the patient is low white blood cells and very low lymphocyte in the blood. So the immune system is very weak. So the secondary infection is very easy in the patient. So I suggest the antibiotics is can be used as early as possible.
Okay, thank you.
Did that answer your question?
How about the personal protective equipment? Can we reuse it? after this infection?
Sorry, how what？
防护设备能不能重复用？他们可能不够。
什么东西不能重复用啊？
防护设备。
他问防护的，就是口罩啊或者防护服啊，可不可以再用
？Okay. So in China, we don't reuse the mask and the isolate suit. We don't reuse them.
Oh, okay. Thank you. Yeah, okay. Thank you very much.
Dr. Rosyanda from Indonesia, are you there?
Yes.
Can you tell us what's happening in your city and ask your question?
Yes, here in Indonesia, especially in Jakarta, is Sunday morning. So as of yesterday, Saturday, the number of the cases in Indonesia is 1155, 1155. Is we are in the almost in the climbing graphic, and the of those 994 cases are inpatient, and 59 are cured, and the 102 patients are died. So it's around 8.7% case fatality rate is high. So I have 6 questions. First is about
Can you ask the first question first? Question first.
About a new wave of the second corona hit in Wuhan. I read an article, patient who were hospitalized and then got treatment and then test negative release, but then after few days or few weeks, they are now in a positive test again, and it is doubtly that Wuhan will lift the lockdown. So it is true, and then I want to know why, because usually if the virus hit our body, the body will produce the antibody, and it means that it is not impossible, but if the patient who has antibody gets the second hit of the virus, the symptom will be mild. So can you explain why there will be the new wave of the corona hit in Wuhan?
朱医生，你先翻译问题，然后再让赵教授回答。
赵教授他就是说，那些人好了，出院了，又开始转阳性了。
In the early stage of the COVID-19 in Wuhan, we cannot we don't have the antibody test, so we test the nucleic acid and the chest imaging, and if the patient meets the criteria, we can discharge them to home, to the isolation center, and but the nucleic acid test for the throat is may have false negative result. So in the early stage, we have some relapse patient, and recently we used the nucleic acid test combined with the antibody test. The relapse cases decreased almost to 0. And in Shanghai, they said they also tested the nucleic acid in feces. they did not find any cases were relapse.
Okay, but
Second question,
yeah,
please. Only in the
but
last question. Okay, two questions for each person most.
okay. No, still this question. I think doctor hasn't answered my question yet. My question is, okay, your patient in Wuhan already got treated, already released after negative test, but then few days or few weeks later, he or she has the positive test. Why it happens? You say relapse? Can the virus infection can be relapse?
No, I think Dr. Zhao said that could be a possibility of a false negative. The test before discharge that was negative could be a false negative.
Oh,
Yeah,
I see. So,
combined with the antibody test, the false negative will be avoided.
Yeah, if false negative, it means that it's dangerous, meaning that after he or she was released from the hospital, he or she will be carrier for other healthy people then.
That's why they request another 2 weeks quarantine before they go home. They will be quarantined in a hotel.
Yeah, the patient is discharged. They cannot be sent to the home. They will be sent to the isolation center, and for another 2 weeks for observation.
Oh, okay, but because there is a different story that I read from the article that released yesterday. So I hope that there is no new wave of corona hit in Wuhan in the few weeks or few months. Okay. So my second question is about the Chinese herbal therapy, because here we have Chinatown, so we can get those herbal therapy. Can you more specify about what is the name of the herbal therapy, Chinese herb therapy, the Chinese herb?
Yeah, I can answer this. I attach those in the resource, the guideline from the Chinese government. They have like a first through the 7th edition. So the 7th edition guideline for management and treatment does include various formula of herbal medicine for different stages of disease. Yeah, so I can send you that guideline, treatment guideline.
Including the formula for prevention.
Right. Yeah, they have various formula for different stages, including the formula for prevention.
Okay, thank you, Dr. Sanyada. We have to move on to the next person. Dr. Carr from Maryland, are you there? Dr. Carr from Maryland. Hello?
You have to unmute her.
Okay, can you describe what's going on in Washington, D.C. area and ask your question?
Tom, this is Dr. Mangat. You have to unmute Dr. Kaur first. We're in different computers.
Okay.
We're in the same house with different computers, so I'll let Dr. Kaur go first. She's sitting downstairs. I'm sitting upstairs with headsets. So
okay,
if you could unmute her first.
Name? Maybe I have to unmute him. What's his name?
Kaur, Harminder Kaur, K-A-U-R.
K-A.
Dr. Kaur.
K-A-U. I didn't see him. I know. I mean, what's his name in the Zoom?
Harminder Kaur, H-A-R-M-I-N-D-E-R, Kaur, K-A-U-R.
A-R. Hold on 1 second. I didn't find him.
Well,
did he raise his hand?
She may not raise her hand because I was the person who asked how to raise your hand. My hand's up. What I'll do is let me try and get her to come upstairs so she can ask a question from this computer. So she'll be up in a few minutes, but I'll ask my questions in the meantime. Dr. Zhao, you raised some very good points about treating early and treating with antivirals early. And I think the core thing to understand is that this is actually a virus that affects your CD4 cells, and that's why they work. My question is a little more targeted because we're seeing patients, and the problems we're having, we're just outside Washington, D.C., is we don't have testing. We don't get testing results back till 5 to 7 days. And it's a nightmare because we have patients presenting with the headaches. That's day 5 of the infection. And as you know, you don't want to go into the cytokine storm, which is around day 10, when the fluid builds up and we get, when we maybe need ventilators. So the question really is twofold. How do we persuade those patients who feel they're getting better after that slight cough, but we know we have a 5-day window to get in there and get the viral load down? What has your experience been in treating that early with antivirals and giving hydroxychloroquine?
先翻译一下。
赵教授，他就是说，他们那里的病人那个检查的结果来得很晚，就要5、6天才能来。但是那个病人他有症状，他又怕要等了以后，那个病人会发生那个炎症的风暴。他就说，你们在这种情况下，就说就觉得是个疑似病例，但是没有那个核酸的结果。那这种情况下，你们是开始用吗？像这个开始用抗病毒的药吗？
So in my experience, the patient at the early stage, we also waiting for a test for the nucleic acid, and but the blood routine test is rapid, and we can find the blood cells, white blood cells, and the lymphocyte in the routine test. If both are very low, I think the viral infection is possible. So combined with the chest CT test, the report will show the viral infection possible in the report of the CT scan. So we start the antiviral treatment, and the Abidol and ribavirin and interferon is the common antiviral medication. So we can use the 3 medications first. And
my understanding was by the time it comes to lungs, your ACE2 things are being blocked by the virus, particularly those who are hypertensive, on ACE receptor blockers and on ibuprofen, which we've been rapidly taking people off to lessen their risk. So what the question really is, we don't want to get to that stage where you have a cytokine storm. That's what I was asking, your experience in trying to get the retroviral drug on early, because the coronaviruses actually affect your CD4 cells in the lungs, as it's been shown in many studies.
没有那 slide。他就是讲那个炎症风暴，他就是说不希望到达炎症，就是在炎症风暴来之前，他就希望开始治疗。他也提到那个就是 那个叫什么就是那个受体，
嗯
就是白细胞上头那个
Okay.
Okay,
if we observe the IL-6 is higher and higher, we use we will be think about the storm, the inflammatory storm. So we will start more treatment about for example the glucocorticoid treatment and IVIG, and the treatment for the convalescent plasma.
Oh, it's not working now.
Is
yeah, we lost
this
yeah, 就有一段没听到。
Okay, so for prevent the inflammatory storm, we use the IVIG and a glucocorticoid for the treatment, and the immunotherapy and the convenient plasma therapy is also a choice. I think the indicator for the inflammatory storm is the IL-6.
I understand you. I get you on that, and that's why you recommended the tocilizumab. I mean, the other thing we should add, we've had some issues getting hold of hydroxychloroquine here in the US. So we've actually been a little innovative and used Cholangi. Cholangi, or Nigella sativa, is the natural precursor for chloroquine and hydroxychloroquine, and that's available globally. So if you want to try, if you're having difficulty getting chloroquine and hydroxychloroquine, I'm sure you have a similar Chinese herb, but it's been very useful, and we use that in patients until we can get hold of hydroxychloroquine, and to good avail. But the problem is when they get better at that point of time, they don't want any more treatments. We're trying to explain to them, look, you're not through the woods yet. We have to get you totally better.
Hydroxychloroquine or chloroquine, right?
Yes, hydroxychloroquine, but we're having difficulty getting that here in the US because of supply and demand. So there's a natural product called blackseed, often known as Cholangi or Nigella sativa. It is a natural precursor of chloroquine and hydroxychloroquine, which is available globally, whether it be in Indonesia or in Brazil. And I'm sure you can go to the Indian store or an equivalent store there, and you'll see it. And basically, it has thymogene, which is the precursor of chloroquine.
So that's herbal medicine?
It is, correct.
I don't know the herbal medicine. Yeah, for the hydrochloroquine or chloroquine. It just in China the hydrochloroquine and chloroquine is easily can be
is available.
Prescribed by the doctor. So
we prescribe it, we can't get it. That's a problem here.
Yeah.
Yes, but the two drugs is only to have a try, and is not the evidence-based treatment. So I think the herbal medicine is also can, if you have and the patient is severe or critical, I think you can have a try.
Sure, thank you.
Okay, Dr. Otel from Maryland, are you there?
Yes, I'm here.
Can you?
In Maryland, we currently have about 992 cases. In my area, we're very lucky. Our county only has 2, and that they came from outside the county. Originally, Maryland was seeded by 3 people coming off a cruise. We don't know about the other ones. My question was whether or not you had noticed that if people had a prior flu vaccine, would they have a worse prognosis?
Oh. 他是说那个病人如果接种了流感的疫苗，他是不是预后会差了？就是他如果得了这个 COVID-19， 他是不是预后会变差？
I don't know the prognosis about the influenza
vaccine.
Vaccine, yeah. Because in Wuhan, the vaccine for influenza is rarely it's rarely. So we don't observe we didn't observe the cases.
So you noticed something like that?
Well, that was information coming, we thought was coming from China and also Italy.
Wow. Yeah, I don't know, like say it's probably a low percentage of resident, like a Wuhan citizen receive the flu vaccine, right?
Okay.
Yeah. Okay,
Can I answer your question, Dr.?
Yes, thank you.
Okay. Melissa, please.
Oh, hi. Can you hear me?
Tell us where you are, is the situation in your place?
Yes. Yeah, can you hear me?
Yes, yes.
Oh, hi. I'm in New York. I'm a pathologist at Sloan Kettering Cancer Center. We're seeing it in our cancer center. And I have 2 questions. And one I think I had seen on the chat. One is there any risk for carriage by animals like pets in the home? Or is it just because they're sort of potentially an inanimate object per se? And the second question is, are you aware of any post-viral syndromes similar to what may have been seen with SARS or MERS? Thank you.
The pets, and that is no report for the pets can carry the virus. Only in WHO website there is a report in Hong Kong as a dog. The dog, only a dog was tested the virus. The positive, but in my experience in Wuhan, we don't find any pets. We don't look the pets as a resource of the infection. What is the second question?
The viral syndrome. 就是他说有没有像那个，就是病人他恢复了，然后他又还有后续的综合症，像其他的 MERS 是有这样子的情况吗
？No. For example, the MERS and the SARS, maybe especially the MERS is the fibrosis of the lung. But is rarely in the COVID-19, and most of my patients recovered and they don't have any syndromes after the recovery.
Thank you.
Xiangming, hello, are you there? Xiangming? Hold on, you can talk right now, Xiangming. Ask your question, Xiangming. Xiangming, hello.
Yeah, I'm from Indonesia. I'm from Indonesia.
OnePlus. Can you tell what's your name and where you are? Ask your question.
Thank you. Good morning thank you for the opportunity. I'm a medical doctor from Indonesia. I want to ask about the prevalence of and the incidence of pediatric cases, and also the recovery or the mortality rate, as well as the treatment for pediatric patients. The second one is, in Indonesia, we have some cases. I would like to know your opinion about that, cases of pediatric patients. Thank you.
呀，他都是问的小孩的问题。
So I don't have experience on children's treatment. I think the children is mild and maybe lately the China will maybe will be report a guideline for children. I think.
Okay.
Last question. Catherine, I notice you are typing something. Catherine? Catherine? Okay, thanks everyone. Actually, Dr. Zhao, do you want to, Dr. Zhao and Dr. Zhu, unmute yourself. Dr. Zhu and Dr. Zhao. Okay, can you wrap up? Do you have anything to say to end at the end of the session? Dr. Zhao, go first.
Yeah, I think even if the pandemic in the world, I think the disease will be controlled by the prevention and the rapid therapy, and I think the hope it's hopeful for us to control the disease.
Dr. Zhu.
Oh yeah. Thank you for the attending and everyone attention. And again, thank you, Dr. Zhao. What I will say is stay calm, and then all this information or recommendation, I think it's a fluid. This is a disease we don't know much about, and we're still learning a lot. So, so we try to keep informed, keep current with all the information. Yeah, and then we'll try to hopefully we can get more this kind of seminar to keep to have exchange of information. Yeah, thank you.
Okay, thank you, everyone. That's the end of the seminar. We're going to summarize the seminar in writing, and the presentation will be sent out by email. So make sure you register. Okay, thank you, everyone. Bye-bye.
Okay, bye-bye.
Bye.